Hi everyone, this is Dr. Rahul Khemani. I'm a consultant psychiatrist practicing in Heart and Mind Clinic, Borivali, Mumbai. Today, on World Schizophrenia Day, I am going to talk about schizophrenia, about how does it affect us and what do we need to do about it. So, schizophrenia affects 1% of the world population. Schizophrenia is a very serious mental health condition which involves the way the person thinks, feels, and behaves. Now, schizophrenia occurs due to a chemical change in the brain. It is a chemical called as dopamine. This neurochemical is responsible for making us act appropriately and to think clearly. And when it is disturbed, then the person is unable to maintain his own reality and starts thinking of everything in a very different manner. So, how do we see the schizophrenia affecting a person? How does the person behave? The person starts having two kinds of symptoms, positive and negative. To look at the positive, the first and foremost symptom that you see is delusion. Delusions can occur in any form. For example, a person can feel that someone is following them, someone wants to harm them, someone is going to steal from them, someone has put a camera inside their house, and someone is plotting against them. Or someone can also feel that the things that are happening around are something against him. The second kind of symptom that you see are hallucinations. Hallucinations are form of illusions where you start experiencing something that is not there in reality. For example, auditory hallucinations where you hear things which are not really being said, or visual hallucinations which you can see something but they are not there. There are other forms of hallucination such as tactile hallucination and gustatory hallucination where you taste something. But the most common form of hallucination in schizophrenia is auditory hallucinations. Also, there is a disorganized behavior where a person becomes very violent, agitated. Based on the delusions and hallucinations, a person acts out and then behaves very outwardly angry towards anyone. Maybe it is someone outside or maybe it is a family member. Secondly, there are negative symptoms where a person is very withdrawn, they don't care for themselves, they are not eating well, they don't sleep well, they have lost all their sense of understanding of their surroundings, they are absolutely disinterested in activities around them, they become very dull and they do not communicate with anyone around. And some of these people leave their houses and go wandering around, and you don't know what has happened to them, and they are found after a very long time. So, this condition is a very serious condition, and if recognized early, it can be gotten better. Now, what are the causes for this? I've spoken about the chemical part. Otherwise, it's a combination of genetic and environmental stressors that are happening outside. But there are certain risk factors. For example, in childhood, if your parenting was not proper or if you experienced a severe kind of trauma. So, this is commonly seen in the age group between 25 and 30, but it can occur across any age group. Now, coming to the most important part, once diagnosed with the help of a mental health professional, this is a condition which can be treated. And how do we treat it? By working on the same neurochemical, that is dopamine. So these medicines, they work on changing the level of dopamine, which brings it back to its normal level, and that is how the person gets better. What are these medicines? These medicines are antipsychotic medications. Obviously, these medicines have some side effects, but these side effects can be avoided with a lower dose of medicine, which again the mental health professional will look into it. Also, there are some other medications which counter these side effects, and that is how you can continue taking these medicines. It is important to understand that this illness is a chronic illness, just like diabetes and hypertension. So medications need to be continued unless and until the mental health professional thinks that this has gone completely under control, and now without medications, the person can be kept under care as well. Other forms of treatment include psychotherapy, where therapy is done for the person, but it is not as effective as medications. And lastly, in severe cases of illness, the person can be admitted in an hospital, and there is a form of treatment called as electroconvulsive therapy, which is found to be very effective and it works very quickly as well. But at the end of the day, the most important thing that you need to remember is that this condition is not something to be shameful or ashamed about. This is a condition which can be treated, with the help of the right measures taken with a mental health professional. So they won't understand the person who have it. It's the family members who can recognize it and bring the person to a mental health professional. Most of the times, family members thinks that this is some sort of depression because the person is very silent and withdrawn. But it's quite the other way around, and when evaluated properly, we diagnose it. So take care of yourselves and get yourself evaluated whenever you can. Thank you.